I think my baby is tongue-tied. Now what? You really want to have a full hands-on assessment by a skilled professional who understands feeding. There are 3 components to feeding that are necessary in order to be able to feed efficiently from breast or bottle: range of motion, strength, and coordination. You need to have all 3 of these working together in order to have good, efficient feeding from breast or bottle. Range of motion is the ability for the tongue to go in and out, side to side, and up and down. It's the up and down pump action of the middle of the tongue that is actually important for breast and bottle feeding. So if a skilled professional came to you and said, well, baby can stick their tongue out, there is no tie, that professional does not understand how breast or bottle feeding work. It's the middle of the tongue that is important, and that is often what is restricted by a true tongue tie. Strength is the ability to create a suction and vacuum inside the oral cavity and maintain that for the duration of a feeding. A baby that pops on and off, is unable to maintain the latch, or has lots of clicking during feeding from either breast or bottle, is telling us that they don't have the strength to be able to maintain that latch for the duration of the feeding. Coordination is how the tongue is actually moving with all of those pieces and parts. You need to have both good range of motion and strength in order to have quality coordination. Coordination means being able to move the tongue in the direction that it should for the entirety of the feeding. A baby without coordination is often very inefficient, loses milk out of the corners of their mouth, breaks the suction, chomps, bites, or uses other strategies in order to try to feed. Those babies can often compensate on a bottle and really struggle at the breast. So when you're looking to be able to see, do I need to have my baby's tongue clipped now or wait? We want to really see what components they have intact. If your baby has good strength and coordination, but their feeding is limited by the range of motion of their tongue, those babies are great candidates to have that tongue clipped right away. Once they have that tongue freed, they're like stallions out of a gate. Their feeding goes very smooth. If you have a baby that has a very weak suck, they're struggling both breast and bottle and are not coordinated, as well as having no range of motion, you really need to address those underlying issues first. If you give them range of motion and they have no strength, those babies tend to be the ones that are more prone to reattachment and still really struggle at the breast. When you have no strength, minimal coordination, and your range of motion is impacted, you really want to be focusing on bodywork or manual therapy first to get the head, neck, core, and trunk strong, as well as suck training and oral motor exercises to teach that baby how to efficiently use their mouth. Those babies may need a few days or weeks or even a month to get ready for that release to make sure that it is as optimal and successful as possible. So how do you know? How will you know whether your baby it's just range of motion or whether it is all 3 areas that are being impacted? I highly recommend finding someone in your area that is skilled and trained in order to be able to assess that. Speech therapists, occupational therapists, and some physical therapists, depending on skill and training, can help you assess for that. And there are some skilled international board certified lactation consultants that have also done additional training in order to be able to help guide that process. Remember, if a healthcare provider just looked in your baby's mouth visually and said, there's no tie, baby can stick their tongue out, they're just fine. That was not a full assessment, and they do not actually know how to assess for appropriate feeding. It takes a full dynamic assessment to see what can the tongue do. Can it stick out, go side to side, and go up and down? Is it nice and strong? And is it coordinated? Those are your 3 pillars to feeding. Now you know.